Tomorrow I'm going to talk about pre-implantation genetic diagnosis, although now it's called pre-implantation genetic testing. Basically, in vitro fertilization, what we found is that 1/3 to 60–70% of the embryos that we produce, depending on the maternal age, are chromosomally abnormal, aside from other chromosomal abnormalities or genetic abnormalities. For instance, a woman that is 30 would have 30–40% abnormal embryos, and then it goes up with maternal age up to 70–80% in women that are 42–43. These embryos, what happens is that they don't implant, they miscarry, or in rare cases they could produce an abnormal baby. So what we do is to do a small biopsy on the embryo. This is done on day 5 of development. At that time, the embryo has about 150 cells. We just take 5 cells from the shell of the embryo that will become the placenta. We're not touching the inner side of the embryo, which is going to be the fetus. So this is basically we're doing a very early prenatal diagnosis. With this, what we found out is if the embryo is normal or abnormal, and the embryos in the meantime they are frozen, and then we just select the embryo that is normal to transfer. So imagine that the couple produces 5 embryos, and she's 40, so 2 of them are abnormal. You could not do PGT, in which case you transfer 1 at a time, and at random, at the end of the 5 cycles, one of them is going to be normal and implanted. What could happen, however, is that if you transfer the abnormal one, we'll have a miscarriage. That could take 3–4 months that it's wasted, in addition of the psychological damage and physical damage also of having a miscarriage. Therefore, if you, at the 4th cycle, you just choose the normal one, then you get to pregnancy sooner. You don't have a risk or very little risk of miscarriage, and so these are the advantages. In the future, now we're working towards a system in which there is not going to be a need for embryo biopsy. The media in which is cultured the embryo has DNA that is produced by the embryo, then we'll be able to analyze it even less invasively.